Let's have a look at how to test a baby using the Sera newborn hearing screening device. During OAE testing, it's really important to test in a quiet room. Any loud noises or talking during the testing can prolong the test time. It's also important to ensure that the baby is calm and relaxed during testing. If they're not, it's better to come back and try at another time after they've been fed. It's okay for the mother or father to hold the baby during testing, as long as the baby is calm with the parent. Take the Sera device and turn it on by pressing the on button here. To start a test, select a new patient, and on this screen you can enter the patient demographic details such as their patient ID, first and last name, date of birth, gender, any risk factors and any other risk factors that you wish to enter. Then press the play button and select the test. Now you're ready to start. You can change the test ear by pressing the ear icon at the top of the screen. Ensure that you've selected the right ear for testing before you place it in the baby's ear. Place the probe in the baby's ear like so, and try not to hold the probe cable during testing, as this can lead to extra noise in the recording. Press the start button on the device and the testing will begin automatically. When the test finishes, you will see either a green check mark, which indicates that the test has passed, a yellow cross, which indicates that the test has referred, or if you have manually stopped the test during the assessment, you will see a question mark, which indicates that the testing was incomplete.